Arizona state health officials report the highest single-day increase in coronavirus cases to date, almost 3,800 new infections recorded yesterday alone. With us now is Arizona Congressman Andy Biggs, chairman of the House Freedom Caucus and member of the Judiciary Committee. Congressman Biggs, thank you for joining us, sir. I want to put the overall numbers of Arizona on the screen if I can. We just talked about the fact 3,800 plus infections yesterday. Overall, 73,000 cases plus, 1,594 deaths. The death rate is still down, Congressman, but are you concerned about the rising number of cases in your state?
Yeah, of course we're concerned with that, Trace, but I mean, you need to look at put those numbers in context. For instance, a lot more testing is being done. We have 2 border counties where they really have increased the number, so they've become the hot spots. Those with the Navajo Reservation up in the northeastern Arizona, those 4 counties really are the spot. But at the same time, we've discharged 4,000 patients since June 1st. We also see that we're holding pretty steady at 85% of ICU beds are in use, so we still have that 15% vacancy rate there. Our ED is about somewhere around 50%, 53%. Our mortality rate has been cut in half in the last month. And also, if you look at our hospitalization rate, Trace, is down by half from just 2 weeks ago.
Yeah, I want to put up, there have been some controversial comments people accusing you of making on masks when it comes to masks. This is from your op-ed in June 19th, the Washington Examiner. You write, quoting here, tyrannical governments have issued mandates that everyone in virtually every place wear masks. Their authority to do so is dubious. A free society might handle this differently. The easiest case is to allow private businesses and landowners to determine the measures they think most appropriate for public health and safety. What exactly are you saying there, Congressman?
There's two things I really want to get at. A lot of these mask orders were initiated without authority or process. And that's important in a free society, that you do things by process. The second thing is you can identify the people who are most vulnerable, which we have done. And even the previous report that talked about you got a spike, but still, it's still the over 65 folks with comorbidities remain the most vulnerable. We can take care of those folks. But what would happen is in a retail store, I would be able to go in. If they require a mask, I might say, that's the store I want to shop at because I feel safer. If they don't require a mask, I might say that's where I want to go because I don't want to be subject to the mask. If I get on the airline, the one I rode yesterday, they said, you got to wear a mask. I wear a mask. That's what I'm getting at.
Are you in favor of them? Are you in favor of people wearing masks? I mean, there seems to be a substantial amount of epidemiological studies that say, look, they work after kind of this back and forth for months. Yeah, they work. Are you in favor of them, Congressman?
I got a stack right here, Trace. This is just the literature reviews, looking at probably 90 studies, and even the ones that say they may work, they'll say, well, but we don't have enough information yet. And the other 2 studies say they don't really work. And so if a store wants me to wear a mask, I'm going to wear a mask if I want to go into that store. That's the point I'm trying to make. We should be able to make that determination. If I own a business, I should be able to make that determination. If you ask me to wear a mask and I'm going into your store, I'm going to put a mask on because I want to shop in your store. That's the point I'm trying to get at, Trace.
And very quickly, I've got to go, but you know, you talk about hospitalizations, and I talked to a bunch of doctors and some hospital people who operate hospitals this week. And in Texas and Arizona, they are saying, they're agreeing with you. Look, the hospital numbers, they're misleading by a lot of the media. The hospital numbers are not that bad. Texas is handling them, and so is Arizona. Your thoughts on that, lastly?
No, I think that's exactly right. We shouldn't cherry pick the data. We should look at the whole context, Trace. When we do, we'll say this is normal, this is acceptable, and we can deal with this surge.
Congressman Andy Biggs, thank you, sir.
Thanks, Trace.